In this podcast episode, the host interviews Dr. Stuart McGill, a renowned expert in back pain, dedicating his career to understanding the root causes of back pain and dispelling myths surrounding the topic. He shares that up to 80% of people will experience some form of debilitating back pain in their lifetime, which severely impacts a person's ability to work and enjoy life. Back pain is often caused by a combination of factors, including excessive stress on the body, poor posture, and lack of movement variety. Factors such as prolonged sitting, repetitive movements, and lack of physical activity contribute to the high prevalence of back pain in the modern world. Dr. McGill emphasizes the importance of balancing stress on the body to prevent injury and pain. He discusses the concept of mechano-stimulation, which involves applying varying levels of stress to the body to promote resilience and prevent injury. Repetitive movements, poor lifting techniques, and prolonged sitting can lead to back pain by causing microtrauma and stress on the spine. Individualized assessments are crucial to determine the specific causes of back pain for each person. Dr. McGill highlights that everyone's body is different, and what works for one person may not work for another. He recommends tuning exercise programs, such as yoga, to suit an individual's needs based on their specific pain pathways and sensitivities. In his book, The Back Mechanic, Dr. McGill provides secrets to maintaining a healthy spine and addresses common misconceptions about back pain. His methodology, developed over 42 years of research, includes sophisticated anatomical models, muscle activation measurements, and load assessments to understand how the spine functions. Understanding the mechanics of the spine, nerves, and muscles is crucial to effectively address back pain. Dr. McGill created a cadaver lab to study the reactions of spines under stress concentrations and conducted epidemiological studies to identify common exposures leading to pain. One of the key insights from McGill's work is the concept of specific back pain as opposed to nonspecific back pain. He challenges the notion that some back pain is unidentifiable and argues that thorough assessment can reveal the specific cause of pain in individuals. This approach involves listening to the patient's story, probing for pain triggers, and conducting precise tests to pinpoint the source of pain. Dr. McGill discusses the limitations in the current medical system, where clinicians may be overworked and pressured to see multiple patients in a short amount of time. This can lead to a lack of thorough assessment and a tendency to label back pain as nonspecific. He advocates for a more personalized and precise approach to diagnosing and treating back pain. Dr. McGill has trained a team of clinicians through his certification program who are skilled in his precision assessment methods. These clinicians are able to conduct thorough assessments, identify specific pain mechanisms, and provide targeted interventions to help patients with back pain. For individuals looking to maintain spine health and prevent back pain, Dr. McGill recommends incorporating the Big Three exercises into their routine. The Big Three consist of the curl up, the side bridge, and the bird dog. These exercises focus on building core stability and proximal control to support overall spine stability and movement efficiency. He explains the importance of proper form and muscle activation in performing these exercises to avoid exacerbating existing pain or creating new issues. Dr. McGill introduces the concept of training in cycles, where individuals perform specific exercises for a set period of time before taking a break to allow for adaptation. He highlights the significance of endurance in preventing back pain, noting that individuals with higher strength but lower endurance are more prone to injury. Dr. McGill also discusses the need to tailor exercise programs to individual goals and demands. For someone who is already active and does not experience pain, incorporating the Big Three exercises may not be necessary. Instead, focusing on specific mobility and strength goals related to activities like surfing or weightlifting can be more beneficial. Dr. McGill introduces the concept of a biblical training week, which involves dedicating one day for rest and deloading and strategically focusing on strength training, mobility training, and cardiovascular training on the other days. He emphasizes the importance of building resilience through proper movement patterns, core stability, and targeted exercises to address specific weaknesses or imbalances in the body. Dr. McGill shares insights from his experience working with professional athletes and conducting assessments to predict injury risks based on movement patterns. He highlights the importance of observing how individuals move in real-life situations to assess potential risks and address movement issues proactively. Correcting posture and movement patterns requires considering individual differences and potential trade-offs in addressing specific issues. In his book Back Mechanic, Dr. McGill provides a comprehensive guide to understanding and improving spine health through proper movement, posture, and exercise. The book includes detailed illustrations and explanations of common movement mistakes and how to correct them to prevent back pain and injury. McGill's approach focuses on empowering individuals to take control of their spine health by understanding their unique needs and addressing them through targeted exercises and lifestyle modifications.